I find that they're probably the strongest group of people that I've ever met and ever will meet. It's very much a put your head down, just get on with the work sort of attitude that we have. This is kind of a kick up their behinds in terms of politicising this group of students. We're looking at Fianna Fáil, Fine Gael and the Green Party as being the type of people that not only did they vote against our increasing our supports and valuing our input into the healthcare system, they went out of their way to amend this bill to ensure that there was no mention of increased supports, no mention of pay, anything other than a pat on the back and saying, well done.
I think it really should bring shame upon the Minister for Health and indeed on the government that our student nurses and midwives are being exploited for cheap labour under the current clinical placement scheme. And I don't think there's any other way of describing it but that.
It is profoundly foolish. It is stupid. It is costing us in the long run because we are losing some of the best nurses in the world because we are treating them poorly, we're showing them no gratitude, and it is any wonder that they are not staying here.
They're being exploited, Taoiseach. They're being taken for granted and they deserve so much more. Not claps, not slogans, not platitudes, but they deserve to be paid.
In the words of a student nurse who was in touch with me recently, I quote, "We are not just students, we are fully integrated into our placements, and despite being a student, every patient I have ever met has called me nurse. To my patients, I am more than just a student. To our government, I am nothing more than that." End of quote.
If you look at the kind of the population of student nurses and midwives in Ireland, the vast majority of us would support our education financially by taking on jobs as healthcare assistants in places like nursing homes or residential settings for people with intellectual disabilities, and these are hugely vulnerable settings for the residents. Ireland's experiencing a massive crisis in nursing and midwifery staffing from a qualified staff point of view. It's become a lot more risky for us as well, just because there's the whole the COVID situation. We have to kind of risk our own health to further our education in a way that we're not paid and exploited to kind of strengthen staffing levels. From what I can tell, the voting habits of nearly 3,500 to 4,000 other nursing students across the country, they've been very much polarised now. I'll be focusing all of my votes towards any member of anyone else, as long as they have a good attitude towards supporting nursing and midwifery from student level upwards. It's a country that needs these nursing students to save the healthcare system going forward. It will collapse. There's no way of it developing without more nurses.